Our first speaker, Clayton Chau, is the director of the Orange County Healthcare Agency and the acting chief health officer. Formerly, he was the chief clinical and strategy officer for Mind OC, the nonprofit entity which he co-founded to support Be Well OC, a private, public, faith-based academic coalition which aims to transform the mental health system in Orange County. Appointed by the 23rd U.S. Secretary of Health and Human Services, he is a member of the Interdepartmental Serious Mental Health Coordinating Committee. He is also a lecturer for the UCLA School of Public Health, an associate clinical professor for psychiatry, and the director for the transcultural psychiatry curriculum at the UC Irvine School of Medicine. Dr. Chau obtained his MD degree from the University of Minnesota and his PhD in clinical psychology from Chelsea University. He completed his psychiatry residency at UCLA San Fernando Valley, followed by a fellowship with the National Institute of Mental Health in psychoneuroimmunology, focusing on substance abuse and HIV. And yes, I practiced saying that. Dr. Chau has conducted international trainings in the areas of healthcare integration, healthcare system reform, cultural competency, veterans health, trauma, homelessness, and mental health policy. He has received numerous awards and recognition for his work. I will now turn this over to our first speaker, Dr. Chau.
Thank you. I was saying thanks to Gail and Allison for the opportunity to join this panel this morning, and welcome everyone. I hope this session will be stimulating for you. My name is Clayton Chau. I'm the current agency director for the Orange County Healthcare Agency. This is my week number 6 on the job, and I'm also the acting interim health officer for Orange County week 1. So welcome everybody. Next slide, please. I thought what I would do is to talk about Be Well Orange County, which is a movement that we started here in Orange County in April of 2017. At that time, we gathered a group of leaders in public-private health system, academia, as well as faith-based, and asked a simple question: do you believe that we have a system of mental health in this county? And obviously, the question is no. We all know that the mental health system in this county, not so different from the state or across the nation, has been silos, and majority of that is due to the different way that the government fund our mental health system, and we base our belief on what mental health should be on the WHO document, the state of well-being, which said mental health is a state of well-being in which every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And so this coalition of the willing in 2017 has a vision that this coalition will lead the nation in optimal mental health and wellness for all residents. This coalition of the willing had its official name later on in around October or November of 2017, and the name is Be Well Orange County. You might have heard about Be Well Orange County. Since then, there's been a lot of activity around mental health in Orange County. Our goal is really to transform the mental health system, to create a new mental health system that is made available for all residents of Orange County, regardless of their insurance status, whether or not they are privately insured, publicly insured, or no insurance. Next slide, please. So this is our envisioned ecosystem for tomorrow. All these pieces together, from clinical services to criminal justice to school, etc. I mean, that's what we envision the mental health system would look like for Orange County. Next slide, please. And how do you do this with all of this different entity coming together that historically either was blaming each other for how the system didn't work, or not working very well with each other due to the competitiveness of the funding availability from state as well as a federal perspective. And we model ourselves after the collective impact with a distributed leadership structure for all the entities that participate in this coalition. The last count I got, it was well over 200 organizations, large or small, public and private, academia, as well as faith-based in Orange County, as well as advocacy group in Orange County that came together to do the work, right? So it's central around a backbone, which is MiNoC, the 501c3 nonprofit organization that I co-founded. The whole goal of this backbone organization is to actually facilitate, coordinate, and align funding as well as policy in programming to help us transform to a new system. The backbone, this backbone organization is not a service provider. Around this backbone are 6 different results, and each result has at least 2 entities in Orange County who are leading and coordinating the work around that result with surrounding impact organization. So pretty much this is the collective impact model that has been developed for the last decade or so and well studied and implemented across the world, stemmed out from Stanford University. So if you are interested, you can Google a collective impact and Stanford University, and there's a lot of literature on this model. Next slide, please. The 6th result that we have identified for Orange County to tackle are reduce stigma, prevent and act early, close treatment gaps, and improve access. Next slide. Strengthen crisis response, establish community wellness hubs, ally partners, policy, and programs. And as you can see, each of the result area has a set of indicators that the community has come together to identify what are the goal and vision, what are the goals for each of the result area, and what are some of the low-hanging fruit that we could tackle first. To date, it sounds very nice and in theory is really good, but you have to have something tangible for the community to see. So the first thing that we did was establish community wellness hubs, and there is plan to create 3 campuses of wellness hub throughout Orange County, North, Central, Coastal, and South. And you probably have heard about our very first campus, which is under construction in the city of Orange. That campus, the completion date for that campus is December of this year, with the start date for services in January of 2021. And that campus will house a spectrum of mental health crisis services ranging from crisis stabilization unit, less than 24-hour services for both mental health and substance use disorder, to short-term residential crisis program up to 90 days for individual with either a mental health condition, an addictions, or a co-occurring disorder. What's interesting about this campus is it is the first of its kind in the country, we believe, where the county put in roughly a third of the funding. The CalOptima, the health plan for a Medi-Cal, Medicaid individual in Orange County, put in roughly a third of the funding. And then the various health systems, such as Kaiser, Providence, Hope Hospital, Memorial Care, put in the other third to build up this new infrastructure. And the money is not a loan, but is actually a donation to build this. And the goal is when we open for services in January of 2021, anyone live in the north and central region of Orange County would have access to services in this campus, regardless of what insurance they have or no insurance. So we are now working on the replicating some of the services, but build on it for a campus in South County. Hopefully by the end of summer, we can announce where that location is. So it's very, very exciting for us. Next slide, please. So that's a rough overview of what Be Well Orange County is. There are other activity around Be Well Orange County, such as we created a community suicide prevention initiative. We also have a community substance use disorder initiative. We are working on a platform where we centralize all of the emergency mental health emergency call in Orange County into one single number navigation system. You might not be aware of this, but currently in Orange County, if you have mental health crisis, there are at least 18 numbers that you could call. So for a family who's in crisis, the obvious number that they would call would be 911, which will eventually take them either to jail or to inappropriately to our regular acute hospital emergency room, where folks with mental illness could sit there for days on and sometimes weeks. If you talk about individual, especially women who are pregnant and have mental illness and needed a hospitalization, you could pretty much sit in some emergency room for weeks, and I have encountered those cases. So our goal is to make sure that we build a system where people can access mental health in a timely manner at the right place with the right services. So let's talk about COVID-19 and mental health. I mean, since the beginning of this pandemic, all we hear about is the physical health condition related to COVID, right? You hear about the positivity rate, you hear about the number of people who die from COVID-19, and you kind of probably have heard that the nationwide, including California and locally, the number of calls that each of our suicide lifeline and our warm line in Orange County particularly have increased tremendously. But we don't really yet know what the effect of mental health, COVID on mental health, because there's a disease uncertainty, right? There are high-risk groups, and then there's also death. How does that affect the community? How does that affect the family that have had loved one die from COVID-19? Clearly, we know there's a lot of literature now talk about the mental health and the emotional wellness of the frontline healthcare providers and first responders. And particularly, there are several studies looking at the mental health needs of the frontline healthcare provider in Wuhan, China. And so if you're interested, you should Google that. It's fascinating. We also talk about social isolation, and we always use the term social isolation, but I think particularly for children, physical isolation is going to be very difficult. As we bring them back into school, how do you tell a youngster that, yes, you can see your friend, but you can't touch your friend, and you need to be 6 feet apart from them? That is going to be very, very tough, especially children with special needs. I don't have to tell you the job loss and income insecurity has caused anguish for our community, right? So people who are poor are getting poorer. People who try to build a legacy for their children now have lost that dream. And then the other number that we seen a dip, and those are the number of domestic violence and the number of child abuse. But I believe that because they happen in silence, usually before the shelter at home, a woman would find a way to escape from a domestic violence situation. But with the shelter at home, where do they go? Usually it's the teacher who identified child abuse cases, but because students are not in school and have not been in school for the last 3 months, how do they identify children who are living in abusive environment? So I think as the children are getting back out into school now, we will see a lot more of those cases. Next slide, please. So the Henry Kaiser Family Foundation have done a study looking at the percentage of adults who say worry or stress related to COVID has had a negative impact on the mental health rate. So for those who live in area where there was sheltering in place, clearly 47% of them in the survey voiced that there are a negative impact on their mental health status. And then for people who are not in shelter in place, there are 37%. So clearly there's a statistically significant differences between those two different populations. Next slide, please. So because this is a women's wellness conference, what about COVID-19 and women's mental health? International data have shown that women have been more likely to experience symptoms of stress, anxiety, and depression during the pandemic. There's an Australian study showing that loneliness has been more of a problem for women than men in this past month under the lockdown. Caregiver load, which I believe Dr. Park is going to talk about, has also been a source of stress, with women almost 3 times more likely than men to be looking after children full-time on their own during COVID-19. And certainly at the healthcare agency, we have had women staff who telework now really are affected by their work full-time, providing the mental health services for the community, and yet they also have to take care of their children who are studying from home. And how do they juggle that, right? We do know that younger female workers are disproportionately affected by the kind of economic crisis in the wake of COVID-19, because historically we know there's a pay differential unfairly between male and female workers in this country, or globally for that matter. And then globally, other places have reported an increase in number of domestic violence. And I believe that as we are releasing, lack of a better word, people back into the community, these numbers will rise with all the stresses that have been happening for the last 3 months onto a family. So next slide, please. So how does COVID-19 affect the mental health system? Express Script has recently reported that in the last 3 months, they've seen a 40% increase in the prescription of anxiety pills, 20% increase in prescription for depression medications, and a 50% increase in sleeping pills. There's an uptick calls to our hotline room, like as I mentioned to you. And WebMD has polled among all the readers, 3,100, and found that 26% said that they felt a sense of trauma from COVID-19. And I think the trauma will continue, especially the thing that keep me up at night is when we bring the children back into school, this physical distancing will be another source of trauma for our kids. Next slide, please. So the long-term effects of the pandemic, there's several studies looking at this, particularly on our experience of the Asian economic recession between 1997 to 1998. As the unemployment rate increases, there's an increase in suicide, particularly in Japan, Hong Kong, and South Korea. And that effects actually have been seen in these populations here in the US, especially in Southern California. If you remember, there were several cases, Korean and Chinese men who burned themselves and their family, or family suicide happening during those 2 years because of the unemployment and the economic burden and the economic hardship. The longer that there's unemployment, the longer there will be mental distress and increased risk of suicide, and we know that. So how do you balance the shelter in place and the downfall of our economy, the unemployment? That is a really delicate situation that everyone have to deal with, right? Not just politicians, but also as a healthcare provider. There's a study that's shown and published in World Psychiatry looking at suicide, that it is highly linked to unemployment in financial insecurity situation, and that the predicted model is that for every 1% increase in unemployment, there will be a 1% increase in suicide. That would translate to about 8,000 to 10,000 additional suicide in the United States as a consequence of the pandemic. And so if you is not aware of this, every day there's roughly, before the pandemic, every day there's roughly 135 death from suicide occur here in the United States. And that is a very conservative estimate, which come about to 49,000 deaths related to suicide in this country. And again, that is a very conservative number. Next slide, please. So what are some of the strategy from an individual perspective? We encourage our clients to eat and sleep well, stay socially connected, even though you physically can see each other, you have shelter in place, but leverage technology to stay connected to your friend, your neighbor, and your family. And then really limit the news and the social media, because it's very, very negative, as you probably have experienced this last 2 days, as it related to some social injustice issue in this country. Specifically, I'm talking about Black Lives Matter. From a community perspective, we need to rally together to support the vulnerable, the senior, the children, the frontline healthcare workers. We need to ensure that we have this neighborhood connection, right? You've seen pop-up food drives and safety and wellness check on their neighbor, etc. These are pocket hotspot of goodness that we don't see enough amidst all this negativity in social media. And at the healthcare agency, we are attempting to bring all those positive pockets in our community to share widely. From a system perspective, we need to increase mental health care. We need to increase access to care, leveraging telehealth, leveraging technology. And clearly, physical health, mental health, and substance use treatment integration is as important as it is now. I mean, we've been talking about it for the last decade, but this is the time that we really have to do it. Next slide, please. And so here are a list of resources that I put out. I mean, I forgot to mention this, but those of you who are in the audience viewing this, you could take out your iPhone or your Android phone and take a picture of all this slide. You don't need to wait for the PowerPoint to be available later on today or tomorrow. Any slide that is important to you, you can take a picture. And so these are some of the relevant number that I believe you need for this topic today, but you certainly can get onto the Orange County OC info, healthinfo.org, and we have listed, we have lots of resources available, as well as the Be Well website, www.beweloc.org. There's a lot of resources that have been published relevant to COVID-19 as well. So I think that is my last slide. Next, please. I think we are keeping this the question and answer to the end. I want to thank you for your attention, and please be safe and be well. And I'm going to pass the next section over to Dr. Ramos.